dysphagia screening that is done for individuals coming into the ER with suspected stroke. We're going to go through each of the items, both non-swallowing and swallowing, demonstrating how to complete each item and then talking about some of the nuances in completing the item. And Jane's going to serve as
the patient.
The patient, yeah. So the first one is somnolent. You always check this out first. It's if a person's awake and alert. So sometimes veterans come in maybe really drowsy. It's hard to maintain wakefulness for them. In that case, don't give. You can stop the study right there. They fail. They don't pass that item. So,
and I'm not somnolent because I'm speaking with you. But if I was somnolent, I would not be. You could not arouse me very well, and I would just not be able to be awoken. So in that case, you would just pass to the next. You would be done with the screening. So, so I'm not somnolent, so we're going to continue.
Right, and it's important to remember that somnolence doesn't equate with orientation. Right. If a person is awake and alert but not oriented, that's fine. You still keep on with the screening. Don't stop. It may be tougher to do the screening in those patients, but don't stop the screening. So the next one, just as you're getting the history from the patient, listen for their voice, look at their mouth, how they're handling secretions and such. So the next one, wet, gurgly voice. As you're asking questions of the veteran, listen to their vocal quality. If you hear wetness or gurgliness there, they failed that item, you stop the screening. If the voice is clear or really just not gurgly, you keep on going. So
if I come in and I'm talking clear, you know I'm not gurgly. But if I sort of can't get my voice clear when I try to get things out, that's gurgly.
So what that is secretions on the vocal cord. So you're just listening for that. Next one, again, as you're getting questions or talking with the patient, getting information, listen for the quality as far as dysarthria. Is speech slurred or is it precise and clear? So you're just listening for really intelligibility. Oops, I can't even say that.
That was dysarthria.
Yeah. So again, how clear the voice sounds, how well it's articulated.
Okay, so yeah, so I can speak to you clearly now, but if I was dysarthric, I would be kind of having a hard time getting my words out. Kind of like that, right?
Right. Okay. Yeah, so that could be it. And don't, like with somnolence, you don't want to equate this with tongue deviation, tongue weakness, or asymmetrical face. So if a person has asymmetry in the face or the tongue, that's one thing, but that doesn't equate with dysarthria. So if you know that, but they're not dysarthric, you still keep on going with the screening. But if you do hear dysarthria, that slurred speech, you stop right there. Okay. Next one, coughing, choking on saliva. Can you do that one?
Well, that's a little difficult since I don't have a lot of saliva, but it would probably be no different if I was starting and I just started coughing all of a sudden because I just couldn't get all my words
again,
out.
You're going to hear that gurgly wetness probably
and
in the
it's
voice.
Forceful, right? They're like,
yeah, and just a lot of saliva, this wet sounding cough. Next one here, drooling or pooling of saliva. So they're drooling or they have saliva in the oral cavity. Again, it's not that they have too much saliva, they just cannot swallow their saliva.
So it starts kind of running out my mouth then? So it's collecting in there. Okay, good.
So just problems managing that. Last one here, patient or family acknowledgement of current swallowing problems. If a person has aphasia, that is difficulty understanding or speaking, they may not be able to tell you that they have problems swallowing. That's where it's good to ask the family. But a lot of times families don't come in with the veterans who are coming into the ER. So if you're not able to get that either from the patient or from a family, you've got to assume that you still need to keep testing. Right. But if the patient or the family does report current problem swallowing, the person fails that item, you stop the screening right there. You don't need to proceed on. So those are the items, the non-swallowing items. Again, they don't have to be done in any order. Somnolence would be good to check out first, though. But other than that, just do your normal H&P and be assessing some of these items. And as you note them, mark them off if they're present. And that just indicates you don't have to screen anymore, that they failed the screening. If none of these are present, though, you would go to now administering the water swallows. And what we've recommended is that you get a cup of water and just another cup, and it can be a medicine cup that has the milliliters marked, or if you don't have that, a styrofoam cup is fine. And just get a syringe in that case. And you want to start out with 5 cc's of water. And so just measure, doesn't have to be super precise, 5 cc's in a cup, and it's going to be a small amount, and the veteran will go if they're awake and alert. That's not enough, I can't swallow that, but yes, they can. Make sure they're sitting upright. They don't have to be 90 degrees, good posture. They don't have to be 90 degrees, but you don't want them supine. They need to be at least 45 degrees. The closer to 90, the better. You give them the cup, and they can drink from either the cup or from a straw. And if a person has hemiplegia or hemiparesis, you may have to do a hand over hand help there just to get that cup to the mouth.
Shall we try that then? Like I can pretend like you.
Okay.
Okay, so
well then in that case would use your left hand and then just try and just, I want you to swallow all of that. After they swallowing, give them a moment just to make sure everything's swallowed. Ask them to say, ah.
ah.
You're listening for gurgliness. If it's wet or gurgly, or after they swallowed, if they had a cough or a throat clear, they failed that item. And that's, you stop the screening right there because they failed that portion. If they didn't cough, didn't have a throat clear, or a wet gurgly voice, you give another 5 cc's of water. Hope you're thirsty. And again, the idea, cup or straw, either's fine. Last resort is administering the water with the syringe. You really don't want to do that because the syringe may be put too far back in the oral cavity and actually cause swallowing problems. So again, swallowing as normal as possible. If the person drools the water out and just swallows a smaller amount, that's okay because that's how they're going to be drinking.
So second time. Ah.
And you really, Jane was a little impulsive there, so maybe a right CVA. You really want to not have the person say ah until you ask them to, because from experience, individuals will frequently drink and as they're finishing swallowing will say all too soon and then have a wet voice or start coughing. So just,
see, I acted just like a patient.
So put your hand up and just let them know, I'll tell you when to say ah.
Okay.
So a little bit bigger amount. This is our, so they passed the 2 5 cc's. Now we're going to a 10 cc swallow. Did you swallow it? Now say ah.
Ah.
Good. Now again, listening for the wet gurgly voice, cough, or a throat clear. If any of those are present, stop the screening. They fail right there, and that's it. You're done. But if not, another 10 cc's. Go ahead. Cough, choke. She failed. So we wouldn't go on in this case. Failed the screening at the second 10 cc. If she hadn't have coughed, though, we would proceed to 20 cc's. So should we go ahead and try that?
So pretend like I didn't cough.
Or that. And so if you're using a 10 cc syringe, it would be twice. And again, a medicine cup is fine. If you've got access to those, that might even be easier. So try to have the person swallow this all in one swallow. Now say ah.
Ah.
Okay, again, no cough, no throat clear, and no wet gurgly voice. And so our last swallow, second 20 cc's. And again, all of this time I'm listening is Jane coughing, having any throat clear? As I'm measuring, and if I hear any of those in between the time I'm measuring this and giving her the next volume, she would fail. So I'm still all this time listening for cough, throat clear, voice change. If any of that's evident in between one swallow and the next, you still count that as a failure. So last 20 cc's. Say ah, ah. We got a star. She passed, so no cough, no throat clear, no voice change on any of the swallows. If that's the case, she passed the screening. You can start giving oral medication, food, liquid, as indicated by the doctor.
So Stephanie, what that means is we step by step go through each one. First the observational ones, which don't have swallowing at all. And if the patient does not pass, they stop the screening there.
Right then. You don't even have to do any other of the non-swallowing observational ones.
And then when they start the swallowing, we have the 2 of the 5 cc's, and then 2 of the 10 cc's, and then 2 of the 20 cc's. And anywhere along the way, if there's coughing or gurgling, they fail.
Or a throat clear.
They fail, and you stop right there. Otherwise, you go all the way through, and they pass.
And this can be broken up, you know, as patients are going to CT scan, as they get a neurology consult coming down. You can start the screening, stop, and then when the patient comes back, pick up right where you left off.
Good. Cough. Okay.
Not related to swallowing.
Okay. So the last thing we want to share with you all is that we also have a template for you to document your dysphagia screening assessment. And you can find it in the shared templates under the neurology templates, and then under nursing. And then you'll see it under neurology, then nursing, and then it says dysphagia screening template. So that should help you document it. And it has each one of the steps that we just went through, the observational steps, and each one of the swallowing steps. Also, if the patient fails, when you click whatever it was, for example, when I was coughing, for example, during the swallow, you would indicate that the patient failed the swallowing, and automatically with that button, when you click that button, it will send a consult to speech pathology, and it will also automatically make the patient NPO, including meds, in the orders. So that saves you a step.
One question. With that, right now in CPRS, we don't have the individual water items broken up, do we?
No, but they will be in the next template. In the next template that's coming out, so it'll still be located in the same place.
So we can't get it in the ER note yet, the ER nursing note?
Not yet. That'll be in the template that's actually in the process of being made.
Okay, so we're working on that.
So we're taking your feedback, and hopefully you'll let us know what you think. If you have any questions after viewing this video, please feel free to call either myself or Stephanie. Thank you.